Hello, my name is Sangeeta Gopi and I'm one of the expert OET trainers at MedCity International Academy. If you remember, I think a week ago we did a series of video, a 4-series video on OET speaking. After that, we also had 2 other videos in addition to that. Now, there's been a lot of encouraging comments and suggestions on all of those videos that we did. I can read certain comments right here. One comment is by FEP Joy, and the comment says, why don't you add feedback at the end of the session so that we could understand what the corrections are. Another comment by Jai Sheila, and she's commented, after video if you could give review like what points are the right ones to say, what cannot be said, it could be better, it can help us improve our speaking. And also a comment by Sharanya Ravindran, and she has said that at the end of each role play, if you can give feedback, it would be helpful for us. So thanks guys for all these comments, and it's good to know that you're really following our videos and that you give us your requests as comments, and we will definitely take them into consideration. So giving due respect to all their comments, we've come up with this latest series where we will include a feedback session after every speaking video, and this is our first such session. So please have a look at the speaking video that you're about to see, and at the end of the video clip you will also have a feedback.
Hi, this is Madan Kumar. I'm acting as an interlocutor today, and this is Tinsy. She's acting as a nurse. Good morning, Tinsy.
Hi, good morning.
And your setting is emergency department.
Okay.
And you are a nurse in the emergency department of a public hospital. You are short-staffed, and available doctors are dealing with patients on a critical priority basis.
Okay.
An aggressive person who has obviously been drinking, who has demanded a doctor to see his mate with a suspected broken arm immediately.
Okay.
Here, your card and your piece of paper and pen. You can prepare for 3 minutes, and I'll let you know when time is up.
Thank you. Hi, good morning.
Good morning.
You looks very anxious today. May I help you?
Yes, because none of the doctors have seen my maid. It's been more than 1 hour.
Okay, sorry to ask you, may I know your name?
Yeah, my name is John.
Okay, Mr. John. Actually, I'm here to help you. I'm here to assess your patient, your friend.
Yeah, but maybe someone else, a nurse came here before. She did nothing. And what are you going to do?
Okay, I'll just help you. Before that, may I know how it happened?
Yeah, I told all these things to your colleague as well. Should I tell you again?
If you tell me, then I could have helped you better.
Fine. We were playing football after having some alcohol.
Okay.
And he slipped and he fell over the ground, and I think he has broken his hand.
Oh, I'm very sorry to hear that. Okay, Mr. John, I can help you out. That before that, let me check his vital signs and let me assess him.
But I feel that you're not going to do anything particularly to him. Rather, you just have to ask the doctor to come and see him.
Okay, Mr. John, don't be more panic. Actually, I'm here to help you.
No, I am panicked because it's been more than 1 hour, and the doctors are not at all coming here at all, and they're watching others who came after we reached here. And we came through the taxi and cab, and I came to emergency department urgently, and none of the staffs, none of the doctors have seen. That is not done.
Okay, I can understand your concerns and the things which you have suffered a lot. Yeah, I can understand you. But one of my triage nurses have already seen him.
Yeah, but she did nothing.
Okay. See, our recent situation, our emergency department is a little busy now. And
yeah, but is that an excuse you're giving?
Actually, I'm sorry, it is not that excuse. Our doctor is seeing one patient, and immediately after seeing him, he will come and see your patient.
But this is the same story from last 1 hour.
Okay, I'm very sorry for the delay. I know that you got so much delayed, but I can help you out. I can help your friend. I can check his vital signs first, and
he's in literally pain. He's in pain.
Yeah, I will help him. I can give him more comfortable position. I can help him with pain management, with pain medications.
Yeah, but whatever, do that quickly and just ask the doctor to come and see him quickly.
Okay.
If not, then I'm going to take some action. I'm going to make you all in trouble, really.
Yeah, okay, Mr. John, I can understand that you are so much loving your friend and so you are so much concerned about your friend. It's very great that you are so much concerned. I'm really appreciating you for that, but let me just assess him. Then only I can inform the doctor about the real scene.
You see, it's been more than 1 hour, I'm telling you again, and we all pay taxes and we have a right to ask and right to be treated in urgently, and I think this is our turn. My friend has to be seen by some doctor. Just go and ask the doctor soon.
Okay, Mr. John. Actually, see, we are seeing the patient according to the priority basis. Some
Do you
patient.
mean that my friend is not a priority for you?
Oh, sorry, you took it in another way. Actually, please be calm, and if you don't mind, please be more calm. Actually, you are disturbing other patients also.
I don't care about others. You're not taking care of my patient, my friend. That is my concern.
Okay, Mr. John, I'm really appreciating you for your concern to your friend, but I'm here to help you. Really, I'm assuring you that I'll give full help to your friend.
But tell me when the doctor is going to come and see
He is immediately coming and seeing your patient, but before that, let me just assess him.
Yeah, but I know that you're not going to give anything after that.
See, Mr. John, actually you looks very anxious and worried. It's better for you to take little rest. Meanwhile, I can help your patient.
So what are you going to do to him?
I will check his vital signs and see. I think his leg is already fractured. So let me send him to the X-ray, and I will give some pain medication. See, he will get relieved from that.
Yeah, but I'm really not convinced. I think he should be seen by the doctor.
I'm assuring you that doctor is coming and seeing him, but before him, let me just assess him, and doctor is coming, he is on the way.
Yeah, but just ask him to come quickly. If not, then just tell me where the doctor is. I'm going to ask him. I'm going to him and I'll ask him to come back to see my friend.
Yes, Mr. John. Actually, I would like to say our reason about the delay. Actually, because of the shortage of our staff.
I don't care your shortage or not.
Okay.
If you have shortage, that's your concern.
Yes, Mr. John. We will help you out soon. Can you please rest here?
Yeah, I'll try, but just ask the doctor to come.
Okay. Really, he is going to come and help you. Is it okay for you?
Yeah, thank you. That's your 5 minutes.
Okay.
You've just heard Madan speak to Tinsy, and she took up the role of the nurse. Now the setting was an emergency department. Whenever the setting is an emergency department, we need to keep certain things in mind. One, what is the tone that we will use to speak? The other, how do we need to progress the conversation? That is, should we have an introduction in the first place? What are the things we need to ask the patient? What is our role there? What do we need to do exactly? Now, dealing a patient in an emergency department is very different from dealing a patient in the outpatient or in a ward. So we need to make sure that the kind of approach that we have to a patient in a general ward is very different. In a general ward, the patient would have been there lying maybe for a few days, sometimes a week. So in that case, the nurse already is acquainted with the patient. But in case of an emergency department, most probably the patient would have been brought there then and there, or maybe just in the morning. So the nurse would be visiting the patient in the afternoon or in the evening, which means the nurse did not have time yet to be acquainted with the patient. So you need to make sure of how you begin the conversation. Now, Tinsy spoke for the entire 5 minutes. I would say there were not a lot of variations in her structure. Her use of vocabulary was quite limited. I would also say that there were grammatical errors quite evident in her speaking. Right from the first sentence she spoke, she started off saying, "You looks very anxious today, may I help you?" It should have been, "You look very anxious today, may I help you?" That is just the grammatical correction. But if I was a nurse, I would deal with it in a different way. Because it's an emergency department, I would first introduce myself, my name and what my role is and why I am there to see the patient. Because I need to make it very clear to the patient that I'm not here to waste time and I'm here for a definite reason and there's a definite purpose. So that was missing in the way Tinsy started her conversation. And after this she said, sorry to ask you, may I know your name? Now that would be another wrong question, because in the card it clearly says that a triage nurse has reviewed the patient. That means there has been somebody already in the patient's room, has checked the details, has given some kind of medical aid to the patient already, which means the case file or the report of the patient would be there. So the nurse attending this patient in an emergency department should not be wasting time asking the patient's name and other details and address and things like that. The nurse should directly say what he or she is there for. So it is very wrong to ask the name. Instead, she could just begin saying, hi, my name is so and so and I'm here for this particular reason. I'm here to review you or review your friend. I know one of my colleagues was here half an hour ago and these are the things that she's checked, and you take the file and you read whatever the triage nurse has done. Probably that would have been a much better way to start the conversation. You're directly giving the message to the patient that you're not here to waste time and that you mean business. Okay? So I would say Tinsy's beginning was a very wrong approach. Relationship building is an important clinical communication criteria and that was not fairly dealt with. And the patient's friend also kept saying that I've already spoken to your colleague before, should I repeat everything again? In spite of that, Tinsy said, yes, I want to know all the details. So make sure you're really clear about how to approach the patient and how to begin the conversation. Also, it's important to continue the conversation. So you need to make sure you're providing a very clear structure. If you notice, throughout, Tinsy has been apologizing for all the problems that has been happening, but she was not really offering any real help to the patient. That is another mistake. So Tinsy was not clear of the structure that she had to use. How should she structure her conversation? Clearly, the tasks asks her to tell that the patients will be seen in the order of medical priority. The doctor is late. So she could have early on itself given the reason why the doctor is not yet there in the emergency department to review the patient. It's clearly mentioned in the card that the doctor is dealing with other patients with critical priority. So she did not make that clear, which is why the patient's carer had to say that she was giving excuses. So I thought when the patient kept saying, the patient's carer kept saying that I'm panicked, I don't want, I'm really angry, I've been waiting for 1 hour. Still she said, okay, I understand your concern. She's been playing it really, I would say really slow. So I thought it is a very indifferent approach. You need to give information there. So there giving information becomes important. You need to say, what is the condition of your friend now? What treatment has already been given? Why is the doctor late? And when the doctor approaches, what will be done? So giving the right information is very, very important there. If that was done, the patient would not have been, the patient's carer would not have been angry. But because she was not really able to give any real justification, the carer got really angry. And when he kept asking her, what new thing can you do for my friend? There's already a nurse who's come and seen her. You're not going to do anything different. Tinsy said, I can give him comfortable position. I can give him pain management and pain medicines. Again, I would say these are the wrong words to use. Now, using the right kind of medical terms, it's important to be professional, but you should also use simple medical terms or non-medical terms, because the person you're talking to is not from a medical background. So it will not be right to say pain management. Okay, that's a medical term. That is something a nurse can understand, but not a normal patient or a patient's relative will understand. So keep it as simple as possible. When the patient's carer said that he is undergoing a lot of pain, instead of saying I'll give pain management, you can say that I'm ready to give some medicines for your friend, or let me have a look at him and I will see what can be done to reduce his pain. But don't say about pain management. I also felt that Tinsy kept apologizing, saying, I'm so sorry, I'm sorry, I'm sorry. It's right to repeatedly apologize, but probably she could have used other ways of doing it. She could have said, kindly bear with us, kindly wait for a few more minutes so that we can assist you better. So repeatedly saying sorry could have been avoided. When he kept asking for the support of the doctor, she said, excuse me, but can I can check his vital signs. Please allow me to check his vital signs. Again, I felt probably it could have been simplified. Now, if the patient's friend was given the right information, he wouldn't be this much agitated. For example, if Tinsy would have said that his friend is not in a very serious condition, he's got his first aid from the nurse who has already met him before. Now, only a review is to be awaited from the doctor. And before the doctor can do a review, it is important to check on his vital signs. As in, it is important to check whether his temperature, his pulse rate, his pressure, everything is normal. So if the nurse can do that right now without wasting time, as soon as the doctor comes, he'll be able to assist his friend. So if this information is clearly given to the patient's friend, he would have calmed down. But instead, Tinsy kept apologizing and she said she wants to check the patient's vital signs. Another thing I noticed is Tinsy did appreciate the friend for his concern. She said, "You're so much loving your friend, you're concerned. It's very great you're so much concerned about your friend. I really appreciate it." Now in speaking, it's good to appreciate. But remember, the appreciation should be for the right reason. A friend showing concern to another friend need not be appreciated. What could have been appreciated is when the patient's friend kept saying, "I've been waiting here for 1 hour and nothing's been done." She could have appreciated his patience instead. She could have said, "I really appreciate your patience so far, and I hope that you continue the support for a few more minutes until the doctor arrives. Please do cooperate with us. Kindly bear with us." This would have been a better way of appreciating. And then she could have said how on priority basis the doctor will visit each of the patient, and because his friend is clearly out of any danger situation, he can wait for a few more minutes before the doctor sees him. So these are my comments for the conversation that you just saw. When you give information, you need to make sure that it is given in proper stages. When you take information, again, it should be relevant information that you take from the patient. So here, asking again what happened to the patient is not required. So Tinsy could have avoided that. Instead, she could have read out the case note saying, "It's written here that your friend has broken his arm, and I think that was while playing football, isn't it?" So putting it across in a question format would have helped much better in reaffirming the facts that are already given in the case notes. So these are my suggestions for Tinsy and for all of you who are watching this OET roll card, and I hope these suggestions will help you prepare better for your OET speaking. Good luck for your preparations.